Welcome to another episode of Whisper Wisdom. In today's episode, we will be covering nutritional trends, Ozempic body image, and what to eat during a very busy schedule. Lastly, we will be talking about food allergies for people who have concerns. So let's get started. Thank you so much, Amy, for joining me today. Could you give me a quick background about your professional in dietitian?
Yes, so my name's Amy Herman. I'm a registered dietitian nutritionist. What that means is that I have a bachelor's degree in nutrition science, as well as completed an accredited dietetic internship and sat for a registration exam to gain my credentials. Registered dietitians are medical nutrition professionals. I have been working for almost 7 years with a infant nutrition company. So that's what I currently do, but I love to work around the community and just spread my knowledge on nutrition.
So what brought you into this field as a nutritionist?
So actually wasn't the first field I was interested in. So I actually went into school thinking I was going to become a lawyer. And a year in, I was super burnt out and didn't really love what I was learning. So I kind of just did some soul searching and thought about what I was really passionate about and what I really loved to do. And I've always loved food and I've always loved wellness. So once I learned about registered dietitians and realized you could actually make a career out of being a nutrition professional, it was an easy fit for me.
Also going to benefit yourself, your own wellness.
Definitely.
So there are so many trends like internet right now about like what to eat. It's a healthier diet. There's a variety of that. Could you list a few to us? What you think is helpful, is healthy?
Well, I think no matter what time it is, there's always some nutrition trend that's rebranded or renamed version of the low carb diet. Like it started as Atkins and then it was rebranded as keto and then it was rebranded as the carnivorous diet. There's been so many variations, but low carb is always a very pervasive nutrition trend. Similarly, I've seen lately a lot of trends around timing of eating. So things like intermittent fasting, which there is some research to show that intermittent fasting can have benefits on blood sugar control. But as a rule of thumb, I think it's best to be skeptical of any diet or nutrition advice that's one, trying to sell you something, and two, not going to be sustainable for the rest of your life. True nutrition and wellness is something that you can keep up with for all of time. So I think all of these nutrition trends have in common that they're very restrictive. And as a dietitian, I am not for restrictive diets. I think with things like low carb diets, you're really missing out on an entire food group, which has a lot of benefits for providing energy and other functions within your body, as well as just not allowing for flexibility, right? Like a diet is not just about how to get the best nutrition. It's about having flexibility and joy and being able to celebrate and do all these other things in our life that food represents. It's always good to take any sort of diet trends with a grain of salt. Just be critical of who's really trying to sell you on this and what are they going to gain out of you following this diet.
I totally agree with you. I think almost all the dieting has similar saying low carb, less sugar, less sodium. If we actually can keep that in our daily dieting, daily food groups, that might be helpful no matter what kind of dieting you're following up with.
Definitely. There's basic nutrition rules that you should be able to follow or try to follow whatever your preferences are. Like you said, things like trying to be conscientious of your sugar and your sodium intake, trying to eat a balanced meal that has all three of your macronutrients, trying to increase your whole foods intake of fruits and vegetables and unprocessed grains. Those are all basic nutrition principles that can be flexed into any diet. Things like trying to be culturally sensitive of what foods your patient or client likes to eat, or if they have any sort of ethical preferences, like following a plant-based diet or avoiding certain food groups for religious reasons. The basic principles of nutrition can be tailored to all of those considerations. And I think that's what makes real wellness different from like a trend diet, is that it can be incorporated through the rest of your life and allow room for flexibility.
Also, consistency for following the same diet in all the way road, like what you just mentioned, is a key of being healthy.
Yeah, definitely.
When we talk about dieting, when we try to restrict more sugar intake, ultimately we're hoping we can have a better body image, we can have a better body shape. I saw so many teenager girls and also for postpartum moms who were considering their body image. How do you view that? Like maybe we can balance that thought out of the dieting.
I think it's a tricky topic because a lot of this is tied up more in psychology and mental health than necessarily pure nutrition. I think a lot of the principles for creating a sustainable diet for yourself can also be applied to body image. Those are things like self-compassion or self-love. The reason that you choose to eat certain foods or healthy foods should not be from a place of self-hate. It should be from wanting to feel energized and wanting to be healthy with disease-free and live a long, healthy life and do the things you love. Those principles can also be applied to body image. Like once you learn to truly love and nourish yourself, then you enter this state of acceptance. I think that's something important that dietitians really are more conscientious of now than ever, but need to continue to educate the public on, is that good nutrition doesn't manifest as one specific body shape or body type. Good nutrition is about having healthy blood work and having good blood pressure and good blood sugar control and minimizing these chronic diseases that are often prevented through certain dietary choices, as well as just nourishing yourself so that you have enough energy. I think it's trying to reshift our paradigm of nutrition and body shape being intertwined and thinking about them more as when you feel good and you nourish yourself, you're going to feel confident, you're going to have energy to exercise and do things you love to do, and you're just going to feel better about yourself all around.
I love your statement saying that because I remember when I was in middle school, I really care about my weight. So I limit myself from only eat one meal per day and I lost my interest for life and I feel depressed. Also, I think my body just reflects really bad. My stomach ache a lot. Even though I did lose a lot of weight, I saw the kilograms are going down, but not my healthy level. It's really bad. So I realized that I need to eat more protein and those are not enough for my body. That was the moment I realized I need to work out, also eat healthy. So that's two things combined can actually help me to maintain a good, at least I think a good body image.
Yeah, I think that's a very common story for women of our generation. I think everybody has struggled with their relationship to food at some point. Like I certainly did at the same age you were discussing, middle school, high school. And I think it's so freeing once you have that healthy relationship with food. I don't think people understand how consuming it is to diet or be constantly thinking about your body or losing weight. It's really just draining and takes up so much mental energy that you could be spending doing things you love or contributing to the world or showing up for your friends and family or showing up for yourself. I do think it is changing. I think in healthcare and media, it's changing, but especially for parents, there are simple things you can do, like being mindful of what media content that your child is consuming. As adults, we can set boundaries for ourselves if things make us feel, bad about ourselves or triggered with the body image, just setting those boundaries and trying to avoid those situations. I think those are some like practical tips you can take.
Thank you. I think that's very helpful. I think starting from last year, there's trend about people taking Ozempic, losing weight, because that actually like a side effect or like the main part is to make the patient lose interest of their food and losing appetite for any food. Nowadays, I see in some med spa start to offering very similar injection or similar products saying that can help or that's similar to Ozempic. How do you feel about that?
Ozempic is the hot topic, yes, in nutrition and dietetics. It is an FDA-approved drug, and there are a variety of patients who actually really would benefit from being prescribed the class of medications that Ozempic falls under. There are patients who have metabolic disorders where their body and their metabolism actually does not work correctly. Combined with a healthy diet and other lifestyle choices, it can be an effective tool. Now, that being said, any patient who is receiving this medication, I believe, should be seeing a registered dietitian, evaluating their diet, as well as obviously doing regular check-ins with their doctor and making sure that they're not having any of the serious side effects that this medication can cause. Now, if we move on to the other side of the coin, there are a whole slew of patients who don't have these errors of metabolism and are just using this as a weight loss medication. I think that there is a lack of nuance in the conversation when we just prescribe somebody a medication to lose weight. If a person truly is struggling with their weight, maybe someone we would consider to have a disordered relationship with food or struggle with binge eating disorder, by just prescribing a drug, we're just putting a band-aid on the situation and not actually addressing the root of the problem. Or are they overeating because they're struggling with mental health disorders that can be addressed through therapy? Is it a lack of education? Is it a lack of resources? Like, we're not actually fixing the problem. Then when it comes to this whole other group of patients, which I can see being the patients who are receiving this medication from med spas and other more aesthetic-based practices, these people might not actually be considered overweight. They might just be trying to obtain a certain body image that the media or society has deemed ideal. This is where the conversation gets really tricky and lacks a ton of nuance, because we're not actually considering that maybe this is just the set point that their body feels best at, or maybe this is just the weight where they're going to be the most nourished and the most healthy. So I do think that it's a slippery slope, and that really the medication should be used for those who have the metabolic disorders that it was intended for, and under the supervision of both a registered dietitian and a medical doctor.
Totally agree. Also, I heard if you stop using Ozempic, and it's very likely that you will go back to your normal eating. So it will bounce back.
Exactly. Like, it doesn't fix anything, right? It's just a band-aid on the problem. Again, we're going back to these trends and these quick fixes that aren't sustainable in the long term. And I think this is just a perfect example where people are looking for some sort of magic pill or quick fix without really considering the implications of what they're doing. Also, there are side effects to this medication. Like, you can develop malnourishment or nutrient disorders or other side effects, gastrointestinal or fatigue. I think that it's really, really important to treat this as what it is, which is a very severe medication that does alter the way that your body processes food, and it alters the way your entire system works. Like, it can alter your pleasure centers.
Nowadays, people are having a very busy lifestyle, and they work early, they will come back, or they will always be on the road to travel for business. And there's many processed food, like frozen food, available in the store for you to purchase. What might be your suggestion for people who are very busy, still trying to eat healthy?
That's a great question. I do think that some of those basic things that we talked about can be applied anywhere. So luckily, we live in California, and obviously there's a lot of healthy food options available everywhere. Make sure you're eating vegetables, trying to seek out vegetables wherever you are, making sure you're trying to have balanced meals where you're getting protein in, as well as getting a healthy carbohydrate. Like, these principles can be applied at most places. I do think another thing to consider is preparing beforehand. I personally, when I travel for work, don't love to go out to eat for breakfast. So I'll just bring some dried berries and walnuts and an oatmeal packet, and then you can just make it in your room and have something really easy. So it's just, I know that I'm having something nourishing that has healthy fats, good fiber, and is going to sustain me throughout my morning so that I don't get hangry. Because if I eat something that doesn't have any heartiness to it, I will crash. Little things like that, maybe bringing your own snacks if there's something that you know is going to make you feel nourished and sustained. Trying to be conscientious of alcohol consumption, trying to get good sleep while you're on the road. Just those basic things that help you feel like yourself. Make good choices.
What about some supplement? Do you take any probiotic or other supplement to help you every day?
I take a couple of supplements. Two of them are very specific niche supplements that are under the advisement of an endocrinologist. But as far as basic supplements, the only ones that I take on a regular basis are magnesium glycinate for sleep. So I'll take 2 to 4 milligrams approximately 1 to 2 hours before bedtime. I also do take a fish oil supplement to get the healthy omega. I also take a turmeric capsule. And the reason I chose those 3 supplements is because those are 3 areas of my diet. I know I'm not eating salmon every day and getting enough omega. I know that I'm not eating turmeric every day and getting all of those anti-inflammatory properties. So it's really just to make up gaps in my diet.
I guess each person is different because your body is lack of something, you just make it up for that part.
Exactly. Like that's why I'm obviously huge on working with a dietitian, or if you have the means, speaking to your doctor about these things as well, and just having regular blood work done to see if you have any deficiencies. You can always ask your doctor to add that onto your blood work, because not everybody is deficient in vitamin D. Not everyone needs to be taking a vitamin D supplement, but really a lot of people are. Having those tools to like test your diet, make sure that your blood levels are okay, and then do more like individualized interventions as far as supplements are concerned based on what your medical professional finds is really the best approach.
About the food sensitivity. Some of people never ever did a test for what they are sensitive with the food. What do you suggest for people having no test at all for food sensitiveness with diary or any type of food to start their journey?
This is tricky because there's a lot of food sensitivity tests on the market that are like at-home tests, and those actually aren't validated tools. So they're not testing for a true allergy. Like a true allergy is mediated by a certain type of immunoglobulin. That's when you go into an allergist and have blood work done and they test you for an IgE-mediated allergy. This is like a true allergy. A food sensitivity doesn't really have a definition. There's no actual validated tool to test for it. Those at-home food sensitivity tests like Everlywell and whatnot are actually not validated tools to determine food allergies. So I do know a lot of people have taken these at-home food allergy tests and they come back, are told they're sensitive to 40 foods that they eat regularly in their diet, and they're not having eczema, they're not having inflammatory markers, they're not having GI issues. And then all of a sudden they're eliminating this entire group of healthy foods for no reason. So I think with food allergy, the biggest thing is to just pay attention and like listen to yourself. If you're having GI issues, if you're having reactions, that's when you know something is wrong. And really the only way to truly diagnose a food allergy is with an elimination diet or a food sensitivity test. So that would be when they would take the food away and then reintroduce it and see how you react, or to see an allergist and have a true test done. But I think for a normal healthy person who's not having GI symptoms, who isn't struggling with chronic inflammation, not having skin issues, I don't really think taking a catch-all food allergy test is necessary, and might end up just giving you false information and causing you to cut out a whole group of healthy foods that you might not need to.
For pizza crust, would you choose a cauliflower or gluten-free?
Depends what mood I'm in, you know? You know, sometimes I want something heartier, sometimes I want something lighter. I think it just depends. I think that's the benefit of having all these choices now, is depending how hungry you are, if you want something lighter or if you want something more hearty, you can make those decisions.
All about the balance of your food.
Yeah, totally.
Thank you so much, Amy. Thank you. I really appreciate it.
Of course. Thanks for having me.
Thank you for listening. If you have any questions, please feel free to contact me, and we will see you next week.